Sanbanani babugeli emakhaya, welcome kulo uhlelo lethu esilithanda kakhulu holistic healthy living. Lapho sifundisana ngezempilo. We are still up and running kuyo women's health. Yes, because it is indeed the Women's Month, and sifuna ukuthi sikhulume sifundisane kabanzi with everything that has to do with women's health. Siyathanda ukuthi sibonge and to really acknowledge our Bishop Nomam Bishop for giving us this opportunity to reach you and to talk to you about all things health. Singakhohlwa ukuthi sithi your health is your responsibility. Kanti ke last week besikhuluma nge-infertility, udokotela wakhuluma kabanzi ukuthi kwenzakalani, iyini, iyenziwa kanjani, nisizakala kanjani, and very importantly he left us with a message of hope. Namhlanje ke nginiphethele ikhathakhatha. Konzima ziyabuya lapha e-studio. Siphethe usisi, a doctor, a young doctor, ozobe asitshela kabanzi ngayo i-HIV and sexually transmitted infections. We have kanti kuthi lapha e-studio Dr. Lesego. Dr. Lesego is a young doctor, a beautiful doctor. Ozaziyo indaba zake. Ukuthi thina we bring you nothing but the best. Ozositshela yena kabanzi ngokuthi ubani, njani, kuphi, kwenzakalani. Doctor, welcome.
Hello everyone. Hi Zinhle. Thank you for having me.
Thank you very much for actually gracing us with your presence. Now, Doc, please, we want to hear it from you. Ukuthi wena ungubani?
Okay.
Yes.
So my name is Lesego Moropa, Dr. Lesego Moropa.
Dr. Lesego
I am
Moropa.
from Pretoria. Yeah. So I studied in University of Pretoria,
Yes.
and currently I'm doing my internship at Krisani Baragwanath Hospital. Yes.
Now, Doc, why did you choose to become a doctor?
So I was one of those weird kids who loved hearing about new diseases, and it would excite me to hear about a new disease and how it affects the body and how it's treated. So I've always had that interest. My mom is also a nurse, so maybe she might have nudged me a little bit in that direction, but it's always been my love. I've always, entertained the idea of maybe doing something else because I struggled to get into medicine.
Yeah.
But it would always be that thing that nudges me that this is for you.
Wow, Doc, you will just have to allow me to go, a bit deeper into that. You struggled to get into
struggled,
medicine.
yeah.
Please
So,
tell us more, because you are here now.
Yeah.
How did you get here?
Yeah. So I applied from matric, applied for medicine because I knew from a very long time that this is my calling.
Yeah.
But then initially my marks were not good enough, so they said, no, we can offer you a BSc degree. And by God's grace, I accepted it because that was actually the only option I had at that time. And then I worked really hard and studied internally, reapplied internally as I was doing BSc. And I was rejected multiple times.
Wow.
I was rejected from UCT. I was rejected even while studying in UP. And then I eventually got that call, and yeah, I'm here.
Here you are.
Here I am.
Here you are, ukhuluma nababukeli emakhaya, and you are actually bringing a message of hope. Because kakhulu you tend to, like they said no, so I'm walking away.
No. If it's something that God has laid on your heart, you cannot stop, trying and working hard. Yeah, and eventually, you will reach your goals.
Eventually you will reach your goals. Amen and amen to that. Wow, Doc, so today, we've been, during this whole month, Women's Month, we've been talking, the one time we spoke about cervical cancer. We also spoke about, infertility. And now here we are, we want to talk about STIs. We want to talk particularly about HIV. Why are these important in women's health?
So HIV and STIs are a very big problem, actually, in general.
All right.
But then I think we also have this patriarchal system that further complicates, the experience of the experience of a woman in terms of like HIV and STI. So it's very important to, as much as we advise men and generalize, there's certain things we need to touch up when it comes to women.
Okay.
Yeah.
Wow. So today we are talking about STIs.
Yes.
What is an STI?
Yeah. So STIs are a group of diseases that, first of all, affects the reproductive system, and it's transmitted by contact with sexual fluids from an infected person.
From an infected person. Now, doc, hey, was umuntu infected?
So usually, sometimes you cannot tell.
Okay.
That's the most important thing, and that's why everyone has to test regularly. So they can be caused by bacteria, some are caused by viruses, and some are caused by funguses.
Okay. Dokotela, what is the difference between a bacteria and a virus? Kanti sifo nje?
No, they're different, and also the treatment as well is very different.
Oh, okay.
Exactly. So with bacteria, you use antibacterials to treat antibiotics to treat bacteria. But then with viruses, some of them, there's no treatment to cure the virus, but then some viruses you can get treatment to treat the symptoms or to treat the viral infection itself, and fungi as well. You have different group of medication that treats funguses as well.
Okay.
Fungi.
So, doc, are you saying if ngitholele ene virus, it's late for me? It cannot be treated. You can only, it can't go away. You can only manage the symptoms.
So with some of them, and especially HIV. So HIV is not curable.
Okay.
But then taking treatment will, so what you're trying to do is make sure that the virus in the body. And then the what we call the CD4 count, which is basically your soldiers of your body, they go up. So you cannot cure HIV, but then the treatment, the antiviral, antiretrovirals, which is ARVs, what they work is trying to make sure that the virus is less in the body.
Okay. Okay, Dokotela, yeah, that was a mouthful.
Yeah.
So, doc, okay, apart from HIV, because, almost everyone knows of HIV, it's on everyone's tongue, but you mentioned the sexually transmitted infections are actually a group of infections. Are there other infections? Well, let's start with the viral ones that we need to really know about.
So the one that most people know about is herpes.
Okay, herpes.
Yes. So there's herpes. There is.
In fact, doc, not so long ago, the doctor told us about HPV, and he said that HPV is a risk factor for cervical cancer.
Yes, definitely.
So that is also one of the examples of viral. STIs.
Viruses, yes. So, and with HPV as well, it can cause warts. So you can have, genital warts, and it can also now progress to cancer. But sometimes it's actually different types of the virus that cause warts versus the one that causes cervical cancer.
Okay. Doc, you mentioned herpes, and I'm sure people want to know, because there's this whole thing, that's why, that's what it's called, a blister, a cough blister. Is that the same thing? Is that herpes?
So there's two types of the viruses. One of them can cause just the cold sore, and sometimes you can actually see it in children, and it's transmitted from saliva that is infected with the virus. And if you share that saliva either by sharing spoons or by kissing, you can transmit that virus. But then the HSV2 is where we commonly see in the genitals.
Okay. So, doc, isuka njani kuma genitals, and how does it get to the mouth?
Yeah, interesting question. So it's transmitted in the genitals, it's transmitted via unprotected sex. Okay. But then from the genitals to the mouth is also via oral sex.
Oral sex. Okay.
And so this is why you need to condomize to protect yourself from such viruses.
Wow. So one wouldn't have thought again, anything asuka from your genitals is a figure emlomeni, and I mean, I can imagine now you're giving it to children that men don't even know anything, and suddenly they have this virus, and dokotela uthi, once you have it, you have it.
And the thing about herpes is, unfortunately, it reoccurs. Unlike with other infections where if you treat it, then you know you're good. But then with herpes, it is known to reactivate in the body. So even after treating, it could still come back.
Okay. Doc, you told us, again, like with herpes, they get blisters. With HPV, they get warts. It presents the same way in males as well.
Yes.
Okay.
So males can get, you can get the warts, sometimes you can get ulcers as well in males. These are now the different symptoms of different STI.
Okay.
Yeah, so like I said, STIs are a group of different infections. So you can get symptoms like an ulcer, which is called a islonda, and sometimes it can be painful, sometimes it can be without pain, and different viruses cause, different infections cause either a painful one or a painless one. You can also have warts. The men can also have warts. And another most important sign is what we call drop. Well, what people out there call drop,
Yes.
which is when you have this, in the male specifically, you have this sort of milky discharge that is foul smelling, that comes out where your urine comes out from the urethra. Yeah, so it'll be foul smelling, it'll be thick discharge that you haven't seen previously before. And then it also smells different. Those are some of the symptoms. And the important thing is that they don't go away on its own.
Okay.
So when you see something has changed on your body, you suddenly see a little bit of an ulcer, you suddenly see a little bit of a pimple, and it's also changing. It's not just the same throughout, a week. It's either getting bigger or it's getting, it changes. There's evolution of that ulcer. That's a very important sign, and you need to seek medical care. You need to at least go to a clinic, let them find out what it is, and then give you treatment for it, because it will not go away. And the other important thing is you have to treat your partner as well. You have to have your partner or partners, which ideally it should be one.
Yeah.
But then, yeah, if you have to be honest about who has been your partner in the past few months, and it's responsible to let them know if you start seeing symptoms, so that they can get themselves tested and treated as well.
Wow, Babugeli, udokotela has said a mouthful. Uyasifundisa, and akagcini ngokuthi uyikhuluma injoba injalo. That is what is amazing, Doc. Kakhulu things are sugar coated. Bayafihla or abakhuluma ukuthi sizwe si understand. And you are saying something as little as a pimple warrants you to seek help.
And I actually want to go on that point, that we hide what's really happening behind closed doors. And it's a disservice to us, because it's happening. And you will see the consequences of it. And now people are sitting with these symptoms because you're ashamed that, first of all, I didn't tell my partner that I was cheating, or that I was seeing someone else, and now I have these symptoms. And if I become honest about the fact that, hey, maybe something is wrong with me, then it's going to start this argument about who's unfaithful. And so people hide because of that, and it's not helping us. We have high infection rates in South Africa, and we really shouldn't. We have treatment options. There's no clinic in South Africa that you can walk into and not get an HIV test if you ask for it. So it's our responsibility to, one, like I said, the ABC of good sexual health is abstain. That is still an option. And be faithful to your partner, and condomize. And condomizing, it protects also from HIV, but also it's a good HIV and other STIs, but it's also a good contraceptive method. So, well, with your contraceptive. But then you have to take responsibility for your own health. And if you are not honest with yourself about the fact that, one, you have multiple partners, you haven't been testing, you're having these symptoms, you have to be honest with yourself and honest with your partners as well, and seek help for your own good.
Wow, babukeli ukshilo utokotela, you must have heard it, and you know utusuzwile, let there be change. Singagcini ngokuzwa kuphela. Utokotela uthi do not be ashamed. If kunenkinga, it is your health, remember. You are the one that will suffer the consequences if ungenzi anything about it. You know, doc, omunye umuntu uthi okay, yeah, maybe I may be having that problem, but ekliniki abosista bazombheka kanjani, like yo bazothi na like bazong
Yes, I always tell my patients, even if bayakuthethisa, fact is they have to help you.
Okay.
Even if bawomanya hore li busy, you're running around wasasanka, you should be, and especially children that are still in high school, if they go with their school uniform, you should be in school, you should be doing this, you should be doing that. It doesn't change the fact that you need help. And I think if you, I mean, if I could, I would change that. I would change how some of these patients are treated in clinics, but then you have to remember, you have to put yourself first. Even if mutua or manya and they rude to you and they mean, but then your health comes first. If you just avoid that and go home and then sit with this thing that continuously gets worse, like for example, with females, the importance of going as soon as possible is you want to avoid the severe complications because some of them can be permanent. For example, in females, the STI can be just in the vulva of the female, just on the outside, on the lips of the vagina. What people call them the lips, but it's called the vulva. So the ulcers or the infection can just be localized and just be there. But then if you don't have it treated, it can actually travel up and it go into your cervix, then past your cervix, then your womb, and then into your tubes. And when that happens, then it can cause infertility later on in life. Because then it causes this thing called PID, which is a pelvic inflammatory disease. So it's not just a simple STI now. It has complicated into something bigger. And it gets that you put yourself at risk of something like that if you don't have it treated sooner. So if you are afraid that by bazoktetisa, remember that they will help you, and that's the most important thing.
That is the most important thing. They will help you. You know, babukeli vele, you need to uzitshele ukuthi regardless of ukuthi abantu bazothini. You know, doc, there's this whole notion bazothini abantu bangibona ngifole clinic. You know, bazothina abantu manje mina sengifunana nama HIV test kusho ukuthi ngicabanga ini. You know, it's
bazothini if I'm in the line for ARVs.
Yeah, like and actually that is, you know, abantu bale whatever is happening in your body.
But you should remember, those same people are dealing with the same problems. So when you are dealing with an STI, it's so common that the same person you're afraid that will be judging you, they probably had an STI at some point in their life.
Yeah.
It is
so
very
doc,
common.
It's common ngaleyo ndlela.
Yes, it's common. STIs are common. One of the other infections that are classified under STI is a Candida infection, which is the fungal infection.
Okay.
And that is actually more common than all the other STIs. It happens to every woman, I think, once in their lifetime, which is it's a vulval thrush, because there are other things that may cause it. It's not just from sexual contact. Okay. So, I mean, these are very common things, and if it happened to you, remember that it probably happened to other women or other men. So I think we need to really deal with the stigma and not be ashamed, because it really, I mean, it's not helping anyone.
Not at all. Doc, you mentioned Candida. Is it the one people was okay, toilet, you know, we UTI?
Yes.
Okay.
It can also cause a UTI, but it's mostly a vulval thrush. So what happens? What happens is your vulva will be very itchy, and then your discharge will also change and be very thick, and they call it cheesy like. So it's very thick, and it can look like almost like cottage cheese a bit. So yeah, that's normally the symptoms of a vaginal thrush.
Okay,
Candida.
and it can be treated, doctor.
And it can be treated. Okay. One of the treatments is actually once off. You can use this pessary. There's different types of treatments for it. You can use this almost like a tablet that you just push up your vagina and it clears up the infection. or the cream that you have to use over 7 days, or the pills. So there's different types of the treatment for the STIs.
Okay. So, Doc, in terms of preventing STIs, what are the modalities? You touched on it, but please can, umuntu, okay, I want to prevent it from here onwards.
So, best ever. The only 100% protection is abstinence.
Dokotela yini abstinence? Kahle kahle yini uku-abstain?
Abstainer is just not having sex.
Okay, it's not having sex.
It's not having sex, and that is possible, especially when you're much younger, because I think, yeah, that's another topic. But then, sex is very complex, and I think when you're much younger, it's safer, health-wise, emotionally-wise, spiritually. It's safer to abstain for as long as possible. But abstinence is the only 100% way to prevent sexually transmitted infections. But then the second way is also be faithful, so do not have multiple sexual partners. And the third one is to use protection with condomize. Importantly, with every single sexual contact. So if you condomize today and tomorrow you don't condomize, you're still at risk. If you condomize for 3 months and then the one day you're like, oh, the condoms ran out, that you're still putting yourself at risk of getting an infection, including HIV. That one time could be enough to cause an infection of HIV or other STIs.
Wow. So, Doc, actually, these are the government condoms, yes, and they are available and they're available free.
Every single clinic. There shouldn't be a place where you walk into a public clinic or hospital where there are no condoms available. What I normally do is when I see my patients in the consultation room, I usually have a box there and I ask them to take a bag. You can be discreet if you don't want everyone knowing that you're getting condoms, and put them in your bag. Remember, it's about your health. Keep that in mind, and over the fear of being judged, or the fear of what people will say.
So from just as little as ukusebenzisa icondom, mhlambe wena uthi okay mina ngeke ngize ngikhona uku-abstaina, don't just uyenze izinto ungabi responsible. There are condoms, you can get them ema-clinic noma kuphi, they are free. Please babukeli emakhaya, we are not encouraging anything enjani. All we are asking is that you take responsibility for your health. Now, Doc, like in terms of condoms, these are the male condoms, yes? Are there any other condoms that can be used? Klampe, abanye, especially, you'll hear abantu bathi ubaba sekhaya akafuna ukusebenzisa condom or ini nje. There's just a lot of things, bangenzani.
So there are also female condoms.
Okay.
That fit into the woman's vagina, like the male condom fits onto the male penis, but this one you actually tuck it into the female vagina. They're also available in clinics, in public clinics.
Okay. And then, Doc, are they reusable, both the male and female, like this one?
No, I mean, and this is why the government has made them free.
Okay.
Because you should not reuse a condom. If you reuse it, the efficacy now goes down from 90%, 90-something%, which also it depends on the fit.
Okay.
So it must be properly fit, because there's a risk of it bursting, there's a risk of it slipping off, so it's not 100% protection that you get from it. But then once you reuse it, it's likely to break and it's not going to be effective.
Okay. And then the female condoms?
The female condoms as well.
Okay.
Not for reusing.
They can't be reused.
They cannot be reused.
Okay. Now, Doc, circumcision.
Yes.
In relation to preventing STIs, can circumcision prevent, like, other people know, but now I'm circumcised, so ngisho?
No.
No.
So whether you circumcised or uncircumcised, you need protection. You need to use condoms to prevent STIs.
All right. And Doc, please do explain, because omunye ka understand bamtshela ukuthi you need to circumcise, you need to get circumcised so that your chances of contracting STIs and bathi angeke ihlale isikhathi eside or anything like that, and now umuntu wenza izinto haphazardly and now they are no longer responsible because hey, they were told ukuthi if they are circumcised they have better chances of not getting STIs.
So if you are not circumcised, the foreskin can act as sort of like it can increase your chances because now the virus can hide inside the foreskin.
Okay.
So I mean, circumcision means you remove the foreskin. So I mean, it lower your chances, but then I mean, it's not 100% way to protect yourself. You need to have condom because the condom acts as a barrier between your sexual fluids and the female sexual fluids, which is the one way that sexually transmitted diseases are transmitted. So you need that barrier between your fluids and your partner's fluids to prevent the infection.
All right. And doc, quickly, who should get circumcised? Who should get circumcised?
So circumcision is anybody that wants to be circumcised.
Okay, so one doesn't have to?
Nobody has to be circumcised. It's a personal choice.
All right. Okay. Now, doc, basitshele not so long ago ukuthi there are certain vaccines, like particularly there's an HPV vaccine, and you told us ukuthi HPV is actually an STI. Are there other vaccines for other STIs maybe?
No.
No,
there's no.
Okay. All right. Doc, asingene kuyo-ke indaba yanamhlanje. I'm sure ukuthi ababukeli emakhaya got an overall idea of sexually transmitted infections. Now we want to talk about HIV.
Yes.
Iyasaba, phamukati, kunzima. What is HIV?
So HIV itself is they call it a immunodeficiency virus.
Okay.
So HIV is a virus that causes also it basically a virus that attacks the immune system, and if your immune system is low, now it opens up to opportunistic infectious diseases. So it's a virus, and that, if not treated, could eventually lead to AIDS.
Okay.
Yes.
So yini AIDS kanti? Abantu bacabanga ukuthi une-HIV, une-AIDS, these terms are used. People think it's one and the same thing.
So HIV is the virus itself,
right.
and then AIDS is acquired immunodeficiency syndrome.
Okay.
So and normally that's when you reach like stage 4, because HIV itself, the disease is a syndrome. It has different stages: stage 1, 2, 3, and 4. And stage 4 is when your immune system is so low that you have all of these different many opportunistic infections.
Okay.
For example, you can have like the cancers that are more common in AIDS, and you can have infections like TB and the other fungal infections of the lung, like PCP. So that's when you have all the end stage complications of HIV.
Okay. Now, doc, umuntu one-HIV uyakhona ukumbona nje kuthi?
No, and this is why it's important to test, and to test regularly. So you need to test when you meet a new partner.
Okay.
Before you engage in sexual activity, you need to test. And once you have tested and you've received each other's results, which ideally you should both go there together, there's also something called the window period, where your test can come back negative, but then it's actually because it's not, the virus is not visible in the body yet.
Okay.
So you need to wait a window period of 6 weeks where you need to repeat your test. But it's important that during that time you practice safe sex.
Okay.
And for partners that are sexually active, it's ideal that you test every 3 months.
Every
3 months.
Okay. Dokotela, if let's say, is one obliged to disclose their HIV status to their partner, with someone that you are sexually active with?
So it's within your right to disclose your status to whoever you feel comfortable disclosing to, but then it's very important to disclose it to the partner that you're having sexual relations with, because now you're exposing them to this virus. So they need to, one, be aware so that they can take precautions to make sure that they don't get the infection. And also, I mean, if you are positive, you have tested positive and you know that you're HIV positive, it's also still important to use protection, because you want to make sure that these are the things you need to do besides just taking your treatment to make sure that your virus stays preferably undetected, but you want the virus to be as low as possible to continue so that your immune system stays strong. So it's important to have that disclosure between partners, because now you might be uncomfortable telling them, but they might also be positive already. So you find that your partner is already positive already, and because you don't want to disclose, that means the likelihood of you using protection between each other is very low. But it's actually great when both partners are aware of each other's status. They can encourage each other, you know, remind each other to take medication, you know, and have a healthy lifestyle together. So, I mean, yeah, it's very important to have that transparency in your relationship.
Yo, babukeli udokotela umention a very important point ukuthi kena wena sowazile ukuthi kukhona okungekho right ngawe, ungabese keke uyathula. You know, talk to your partner, let them know. Remember, you protecting yourself, you are also protecting the next person. Masinga spread this virus wazi kahle kamhlophe ukuthi unayo. You know, that is just you know, yeah. Now, doc, is there such a thing called reinfection? Like, let's say, Mina, I'm positive. I know I'm positive. Asiti, now you are positive.
HIV positive.
Yes, HIV positive. I'm HIV positive. You are HIV positive. Siyazi ukuthi si HIV positive. Can you guys reinfect each other? Is there such a concept?
So what could happen, and this is if you don't use protection, right?
Yes, yes.
So what could happen is, like I said, with HIV, you want to make sure that your immune system goes up and the virus goes down.
Yes.
So if you are both positive and you continue engaging in unprotected sex, what you could do is basically transfer the virus between each other.
Okay.
And in that way, then the virus won't be low. The virus will now continue being, you know, you'll have a higher viral load. And the higher the viral load you have and the lower immune system you have, the likelihood of having, you know, the infections like the fungal infections, the TB and other complications of HIV.
Okay, and doc, umuntu esekazile ukuthi u-HIV positive. Let's say now I am a mom.
Yes.
And I am HIV positive. Can I have HIV negative children?
That's a very important question. You can have an HIV negative baby if you are an HIV positive mom.
Yes.
You can be pregnant and HIV positive and still deliver an HIV negative baby. So what we do in clinics is this program called Prevention of Mother-to-Child Transmission. So what we do is, once a woman is pregnant, and ideally you should approach the clinic before you conceive.
Okay.
And what we do is we try to make sure that before you conceive, the mother's viral load is lower than detectable. The mainstay thing is to make sure that the mother's viral load is low. And but then if you already have conceived, go to the clinic as soon as possible so that you can book your pregnancy. And what we do now is track your treatment. We make sure that you have you're taking your treatment regularly and your viral load stays low. And at delivery, we also check your viral load to make sure that it's low. So now that guides us in terms of what treatment to give your baby to prevent your baby from having HIV.
Okay.
Yes, and depending on your viral load, we can give your baby treatment for 6 weeks or 12 weeks, and also depending on whether you breastfeed or not, which is another point.
Yes.
You can
breastfeed when you are
baby
HIV
while
positive?
you're HIV positive.
Ooh.
But the most important thing is if your virus is low.
Okay.
So you can breastfeed if your virus is low, and the only thing is that you cannot mix feed.
Okay.
So if you're going to choose bottle feed, you can't choose bottle feed and breastfeed at the same time. You have to choose one of them. And that's one of the things we do to prevent the baby from having an HIV.
All
But
right.
it's very common.
It's
But only if you follow, you follow your dates, you take your treatment regularly. Do not stop taking your treatment. Some women are afraid that maybe it's not safe in pregnancy because we know that when you're pregnant, there's a lot of medication that you shouldn't take. But that is a very safe, it's safe in pregnancy.
Okay.
And it would be worse to not take it during
Okay.
pregnancy.
All right.
Done.
Doc, you've been mentioning viral load lower than detectable. Kahle kahle, what does that mean? Does it mean ukuthi ayisekho because phela nikhona ukuyidetect?
No, so it means it's so low that we can't see it. So the virus is there because we know that HIV cannot be cured.
Okay.
So the virus is there in your body, and certain HIV tests may not even pick it up. So I've heard people say, no, I've been on treatment and I retested and I'm negative. But then maybe it's on a specific test. So the virus will be there in your body, but then it will be so low. Sometimes we use the number 50. So once it's below the number 50 or the number 20, then it's not detectable anymore. But we know that the virus is there. So once the virus is that low, then you'll have a relatively healthy life.
Okay. Okay. Now, Dokotela, I'd like us to move to can HIV be prevented?
Yes, HIV can be prevented.
Okay. How so?
So HIV can be prevented by, again, abstinence.
Okay. Yes.
Abstinence, but also HIV can not only be transmitted through sexual fluids.
Okay.
So you can also get HIV by if you are sharing razor blades, or if you are injected by a needle that had been used on an HIV positive person, or maybe, for example, I had a baby who was playing outside and then she got cut by a razor blade that had been used by somebody who's HIV positive. So those are one of the risks. But then you don't get HIV from kissing, you don't get HIV from sharing utensils with somebody that has HIV. But how you can prevent it is avoid, sharp objects like needles and razor blades, especially that are used by somebody who's positive. But also regarding sexual contact, you can prevent it by using condoms and also having one partner, sticking to one partner.
Okay. Doc, quickly with, the example you made about one of your patients who were in contact with a razor blade, your muntu that was positive. Let's say now, you just had, could be a needle prick or something, any risky event, in fact, where when you were certain Uguti, the other person is HIV positive, rape, for example,
rape is a very good
and
one.
Uguti ish, this person may be HIV positive. Is there anything that I can do instead, in terms of prophylaxis? Is there anything that I can say?
There is medication that we give in those high-risk situations. A very important one is sexual assault.
Okay.
So if you had been raped and you don't know, you don't have to know the HIV status of the other person.
Okay.
So you can go to the clinic and you will be given medication that should preferably be started within the first 72 hours of the incident.
Okay.
And that medication can be taken over a period of say 28 days to prevent infection with HIV.
So, Doc, is this medication free?
Yes, it is free in the clinics.
Okay.
If you go to any public hospital or clinic, they offer those services.
Okay.
So, like for example, with that baby, the mom came concerned that her child was cut by this blade. So we gave this child medication. We test initially if the baby was HIV negative to start with before we start the treatment, and then we put them on treatment to prevent infection, and then we test again in a month's time.
Okay. And so if you test, let's say initially, and you find they are positive, then they won't even be getting the prophylaxis.
Yes. So
Okay.
ARVs, there's different groups of ARVs.
Okay.
So yeah, so she'll be getting now ARVs to sort of treat a confirmed infection. So we use different treatment for confirmed infection versus prophylaxis to prevent infection. So then they'll be getting treatment for the HIV infection.
Okay, wow, that is quite interesting. And Babugeli, once again, siyafunda, so that we are able to make better choices in the future regarding our health. Now, Doc, is it possible, does a relationship between a HIV positive person and an HIV negative person work? Can it work?
Yes, it can definitely work.
And I mean, they are sexually active. Can the negative one stay negative?
Yes. So you can have couples that either both couples are HIV negative or one is negative and the other is positive. The most important thing, like I said before, is disclosure. So you need to disclose your status to your partner and have, work together in terms of, how to make sure that the other partner doesn't get infected. The important part is that the partner who is HIV positive needs to continue taking their treatment.
Okay.
Because if their virus in the body is low and it's lower than detectable, then it lowers significantly the risk of them infecting their HIV negative partner. And secondly is also continued condom use. But then you can have a couple where one is positive and one is negative, and you may still continue being negative.
Okay. Now, Doc, how does, an HIV negative man, here's an example. You have a HIV negative male, HIV positive female. They want a child that is HIV negative. Is that possible?
Yes, and that is possible. So there is fertility clinics that can assist with that. But then another thing that this category would fall into, that high risk, where we can give the HIV negative partner prophylaxis.
Okay.
Yes, for that period while they're trying to conceive.
Okay.
But then besides that, if you want to conceive naturally, but if you don't and you don't want to increase the risk of the other partner getting positive, you can have other routes of fertility, of conceiving a baby, and another one is artificial insemination.
Okay.
Yeah, so there's other options if you don't wish to take the risk of having a natural conception.
All right. Doc, let us talk about the stigma surrounded, over HIV.
So I think the positive thing is that it has gotten less.
Okay.
So I think the community is more receptive of the fact that this disease is amongst us, and it's not a death sentence. You can still have a relatively healthy life while you take your treatment. And I think hopefully now we've recognized that HIV has many faces. So it's not just certain people that have the virus. It can happen to anyone. It can happen to somebody who's more conservative. They don't go out, they don't party, they don't drink. It can happen to the young, the old. It can happen to 60-year-old abogogo. It happens to abogogo. It happens to the older females. Around our mothers. It can happen to me. It can happen to you. It can happen to younger children as well. So I think the most important thing is to recognize that it can happen to anyone, and it doesn't necessarily reflect anything on you as a person.
Okay.
The most important thing is, now that you have HIV, what can you do about it? And that is take care of yourself, take care of your health, and to make sure that you have the best possible life. But I think the stigma is getting better. It's better than it used to years before.
Okay. Now, Doc, how many sexual encounters, risky sexual encounters, should you have to get the virus?
It could be just the one sexual encounter.
Just one?
Just one. All it takes is that one moment of weakness where you're like, well, we've been condomizing, there's no condom, no. All it takes is that one event. And
then, okay, Doc, what if it's an event, and how long? Omunye umuntu angathi no, but it was just a quickie. It didn't even last 5 minutes.
It doesn't, because the virus is in the fluid. It's not like it's in some, I don't know, it's in any fluid that comes out of your body. So as soon as there is contact, there is risk.
Okay. And Doc, when you find out you're HIV positive, when should you start treatment?
preferably immediately.
Okay.
You should start treatment as soon as possible,
Okay.
because the longer you wait before you take your treatment, you know, the longer the likelihood of complications. So you have to start your treatment immediately. I mean, it's a huge thing, right? Like you have been healthy all your life, and then suddenly they tell you you're HIV positive, so you may go through those emotions of, but I'm this age, but I'm not married, what am I going to say to my mom, you know, my dad is a pastor, you know, so you may go through those emotions. And I think it's okay to take a day or two to really, you know, accept what is happening, and because you have to prepare yourself mentally for a new life, that now you're going to have to live a different life where you constantly taking medication on a daily basis. So it's a huge change, but I think it's acceptable to take a day or two to really readjust, and maybe get some post-testing counseling, and maybe have a family member that you can trust, that you can disclose to, and get some emotional support. But start the treatment as soon as possible. Do not delay, because people stay in that denial phase for too long, and by the time perhaps you decide you want to take treatment, you know, 5 years has gone by, and now you have all of these other infections. And instead of just dealing with that one thing, now, you know, it becomes a much more complicated thing. So it's expected that you might have, you know, you might not start immediately after diagnosis, but keep in mind that you cannot wait too long.
You cannot
wait
too long. Babugeli emakhaya udokotela uyasitshela ukuthi kumele uyithathe i-treatment as soon as possible. Ungalindi ucabanga ukuthi izozihambela, you know, doc, abanye bathi izohamba, you know, and abanye bayenza izinto, you know.
And some people try to do alternatives. They think, let me go to church and pray about it, let me go to Isangoma and try this and that. But I think, you know, if you want to take time to pray about it, do that.
Okay.
But I think there's a place for medical, like what we call quote unquote Western medicine.
Yes.
But then it works. You know, it changes your life. So I think if you feel like you need time to pray about it, but also get your medication. You can do both.
You can
do both.
And doc, HIV is not a death sentence.
It is not a death sentence. There's
so
so
you
many
can
people,
live a fruitful life.
You can live a full, relatively healthy, fulfilling life, as long as you make sure you take a treatment. For most people that eventually get to the point where their virus is undetectable, you can't even tell. They're going on to live, you know, a very full and exciting life. The only difference is that when it comes to a certain time, they take their medication, because you have to take it at the same time every single day.
Okay.
So they know that at 7 o'clock, it's lifelong treatment.
Okay.
At 7 o'clock, I take my treatment, then I go back to my life. Once in a while, maybe at the beginning of taking treatment, maybe once in a month, I go to see my doctor to make sure that everything is fine, and then I go back to my life. And once you get to a point where you've been taking your treatment for long, you might only need to see a doctor once in 6 months. You know, if your treatment is going well and you don't have complications. So you can have a very healthy, relatively healthy and happy and full life with HIV.
Wow. You know, Dokotela, so basically, would one be wrong to say iktishifane njenge chronic illness? Because
yes, it's like your mother who has to take treatment for hypertension, for high blood, and somebody else who has to take treatment for diabetes. It's the same thing. It's treatment that you have to take to make sure that you keep living your life and continue with whatever dreams you had before you had HIV. Continue to working on them. Whatever life you were hoping for before you had HIV, you can continue doing that as long as you take your treatment.
Wow. Siyabonga kakhulu kuye udokotela wethu. Sesiyafika ku that part of the show where we need to say goodbye. But before we get there, doctor, we would like to thank you first and for all ukuthi uze kithi and ukhulumisane nathi about, you know, STIs and HIV.
Thank you for having me. I had fun.
It was really, really amazing. Doc, please, your last words that you would like to say to the viewers out there.
I would like to say that take care of your health. You are responsible for your own health. It's not somebody else. And you can really live a healthy life with HIV if you just take your treatment.
And you heard it from the doctor herself. HIV is not a death sentence. Ikona I treatment you can live a full and long life. Asiznagegeleni, asiznagegeleni, asizinagegeleni. Remember, it is all in your hands. Siyabonga ukuthi nihlanganyele nathi kuyo le show yethu esithanda kakhulu i-holistic healthy living. Kanti ke sesizothi kinina siyabonga nisaleni kahle. I am your host Uzinhle Wakamazibuko. Sihlangane futhi next week at the same time. Thank you.
Mbukele ekhaya uma ufisa futhi ukupartnerisha no Bishop Ndinhlapho ne GNF ne God Never Fails financially monthly uyisupport